Welcome to your nursing space. I'm Mark Johnson. Today we'll solve some NCLEX adaptive questions. Before we jump in, let me explore the new ExamSAPI dashboard featuring our adaptive test bank. At the top, you'll see your daily goal and study streak. Great for tracking progress and staying motivated. Below that, you can either create a personalized test or try the adaptive quiz experience, both designed to fit your learning style. The daily challenge offers 5 quick questions to keep your streak going. Scroll down to see your NCLEX readiness, content area performance, and personalized next steps, all updated in real time. You'll also find focused tools like time practice, pharmacology review, and the nursing skills lab. Now let's get started. Click Create Test. Choose Tutored mode to see rationales after each question, or timed mode to review them at the end. Select your difficulty, then pick a content area. Today we'll use the adaptive quiz to let AI tailor questions to your level. Choose how many questions you want and hit Start Test. The platform will instantly generate a custom quiz to match your current performance. Good luck, and let's crush this exam together. On our exam ASAP, we have audio option where you can play the questions to help you studying.
A 68-year-old patient with respiratory distress syndrome is admitted to the hospital. The patient is experiencing anxiety due to their difficulty breathing and fears about their prognosis. As the nurse, what is the best approach to help the patient cope with their anxiety? Encourage the patient to focus on their breathing and provide reassurance. Minimize the patient's concerns by stating that the medical team is handling everything. Advise the patient to avoid thinking about the situation and try to distract themselves with television. Inform the patient about the potential complications of respiratory distress syndrome and possible outcomes. The correct answer is A. Rationale. Correct answer A. Encouraging the patient to focus on their breathing and providing reassurance can help reduce anxiety by promoting relaxation and a sense of control. Breathing exercises can activate the parasympathetic nervous system, which counteracts the fight-or-flight response. Reassurance from the nurse can help the patient feel supported and less alone, which is crucial during distressing situations. This approach aligns with therapeutic communication techniques and promotes patient-centered care. Distractor rationales. B. Minimizing the patient's concerns is dismissive and can increase feelings of anxiety and helplessness. C. While distraction can be helpful, ignoring the situation may prevent the patient from processing their feelings effectively. D. Providing detailed information about potential complications may increase the patient's anxiety rather than alleviate it. Clinical tip: use open-ended questions and active listening to help patients express their fears and anxieties. This can lead to more effective coping strategies tailored to individual needs. A 45-year-old client with a recent diagnosis of myasthenia gravis is admitted to the hospital for symptom management. The nurse is planning care to help reduce the risk of muscular fatigue. Which nursing intervention is most appropriate to include in the care plan? Here are the options. Option 1. Schedule physical therapy sessions in the late afternoon. Option 2. Encourage the client to perform daily tasks independently without assistance. Option 3. Plan short, frequent activity periods with ample rest in between. Option 4. Provide a high-protein diet to boost muscle strength. The correct answer is C. Rationale. Correct answer C. Scheduling short, frequent activity periods with ample rest is vital in managing myasthenia gravis. This approach helps prevent overexertion, thereby reducing the risk of muscular fatigue, which is a hallmark of this condition. Clients with myasthenia gravis often experience increased muscle weakness with prolonged activity, so balancing activity with rest optimizes their energy levels. This intervention aligns with the principles of energy conservation and is an essential component of basic care for these clients. Distractor rationales. A. Physical therapy should be scheduled during periods of greatest strength, typically earlier in the day, to prevent overexertion. B. Encouraging independent tasks without assistance can lead to fatigue and frustration due to the client's muscular weakness. D. While nutrition is important, a high-protein diet alone will not specifically address the fatigue associated with myasthenia gravis. Clinical tip. For clients with myasthenia gravis, plan activities for times when they have the most energy, typically in the morning, and always allow for rest periods to manage fatigue better. A 60-year-old male client, recently diagnosed with mesothelioma, is attending a health education session focused on prevention and lifestyle choices. The nurse plans to discuss measures to support lung health and overall well-being. Which of the following topics should be included in the session? Select all that apply. Here are the options. Option 1, smoking cessation strategies. Option 2, importance of regular physical activity. Option 3, high-protein diet. Option 4, annual influenza vaccination. Option 5, details on asbestos exposure history. Rationale. Correct answers A, B, and D. A. Smoking cessation is crucial to lung health and can significantly impact disease progression and overall respiratory function. B. Engaging in regular physical activity improves cardiovascular health and enhances lung capacity, which is particularly beneficial for clients with respiratory conditions. D. Annual influenza vaccination is important to protect against respiratory infections that can exacerbate mesothelioma symptoms. Distractor rationales. C. While a healthy diet is important, focusing specifically on a high-protein diet is not the primary focus for promoting lung health in mesothelioma. E. Discussing past asbestos exposure may be relevant to the client's history, but does not directly contribute to current health promotion strategies. Clinical tip. Encourage clients with respiratory conditions to avoid exposure to environmental pollutants and to pursue vaccinations to prevent infections. A 78-year-old female resident in a long-term care facility has been diagnosed with a urinary tract infection, UTI. As part of her care plan, the nurse needs to ensure safety and infection control. Which of the following interventions should the nurse prioritize? Here are the options. Option 1. Encourage the resident to ambulate independently to the bathroom. Option 2. Place a bedside commode and ensure proper hand hygiene before and after use. Option 3. Increase the resident's fluid intake by providing a large pitcher of water. Option 4. Teach the resident to self-administer prescribed antibiotics. The correct answer is B. Rationale. Correct answer, B. Placing a bedside commode and ensuring proper hand hygiene is crucial in preventing falls and controlling infection spread. In a long-term care setting, older adults are at increased risk for falls, especially when they may feel urgency due to a UTI. Providing a bedside commode reduces this risk. Hand hygiene is essential to prevent the spread of infection within the facility, both for the resident and healthcare workers. Distractor rationales. A. Encouraging independent ambulation may increase the risk of falls, especially when the resident may have urgency and potential weakness. C. While increasing fluid intake is important, providing a large pitcher of water without assistance could be unsafe for a resident with mobility issues. D. Teaching self-administration of antibiotics is not appropriate in this setting, as it does not address immediate safety and infection control needs. Clinical tip. Ensure bedside commode access for residents with UTIs to reduce fall risk and promote infection control with proper hand hygiene practices. A 3-month-old infant with a congenital heart defect is admitted to the pediatric unit. The parents express concern about how to safely transport their child within the hospital for various tests. What is the nurse's priority action to ensure the infant's safety during transport? Here are the options. Option 1. Use a specialized infant transport incubator. Option 2. Have a parent carry the infant in a sling. Option 3. Allow the infant to be transported in a stroller. Option 4. Place the infant in a standard hospital wheelchair. The correct answer is A. Rationale. Correct answer A. A specialized infant transport incubator provides a controlled environment that ensures the infant's physiological stability during transport. It offers temperature regulation, monitoring capabilities, and protection from environmental factors, which are crucial for infants with congenital heart defects who may have compromised cardiopulmonary function. Using this equipment minimizes risks such as hypothermia and allows for immediate intervention if needed. Distractor rationales. B. Carrying the infant in a sling may not provide adequate support or monitoring, increasing the risk of hypoxemia or other complications. C. A stroller does not offer necessary monitoring or protection from environmental changes, potentially endangering the infant. D. A standard hospital wheelchair is not designed for infant safety or monitoring, especially for those with complex medical needs like congenital heart defects. Clinical tip: when transporting infants with medical vulnerabilities, prioritize equipment that ensures continuous monitoring and environmental control to prevent complications. A 32-year-old client with multiple sclerosis is admitted to the hospital due to exacerbation of symptoms, including muscle weakness and diplopia. The client is experiencing difficulty with mobility and fatigue. As part of the basic care plan, which nursing intervention is most appropriate to help the client manage these symptoms? Here are the options. Option 1. Encourage the client to take short, frequent rest periods during the day. Option 2. Advise the client to perform all activities in the morning while energy levels are higher. Option 3. Restrict fluid intake to reduce bathroom trips and conserve energy. Option 4. Encourage the client to perform continuous physical exercise to improve muscle strength. The correct answer is A. Rationale. Correct answer A. Encouraging the client to take short, frequent rest periods helps manage fatigue, a common symptom of multiple sclerosis. This approach balances activity with rest, preventing excessive fatigue that can worsen symptoms. Short rest periods allow the client to conserve energy and maintain a more consistent energy level throughout the day. Educating clients on energy conservation techniques is crucial in managing MS symptoms effectively. Distractor rationales. B. Advising all activities in the morning may lead to exhaustion, as energy levels can fluctuate, and rest is essential to manage fatigue. C. Restricting fluid intake is inappropriate, as it may lead to dehydration and urinary tract infections, which are common in MS. D. Continuous exercise can exacerbate fatigue. Gradual, balanced physical activity with adequate rest is more beneficial. Clinical tip: in multiple sclerosis care, encourage patients to balance activity with planned rest periods to help manage fatigue effectively. This strategy aids in energy conservation and symptom management. A 28-year-old client with systemic lupus erythematosus (SLE) is admitted to the hospital with a flare-up. The nurse is preparing a plan of care. Which intervention is most important to include in the care plan to minimize the risk of skin complications? Here are the options. Option 1. Apply a heating pad to affected joints. Option 2. Encourage sun exposure for vitamin D synthesis. Option 3. Advise wearing long sleeves and wide-brimmed hats outdoors. Option 4. Recommend frequent hot showers to manage joint stiffness. The correct answer is C. Rationale. Correct answer C. Wearing long sleeves and wide-brimmed hats outdoors is crucial for clients with systemic lupus erythematosus (SLE) to prevent photosensitivity and skin damage, which can exacerbate flare-ups. SLE causes an increased sensitivity to UV light, leading to rashes and other skin complications. Protecting the skin from the sun helps reduce the risk of exacerbating skin lesions and overall disease activity. It is a key aspect of managing SLE and maintaining skin integrity. Distractor rationales. A. Applying a heating pad can worsen skin sensitivity and does not protect against UV light, which is crucial in SLE management. B. Encouraging sun exposure is contraindicated, as it can trigger skin flare-ups in SLE due to photosensitivity. D. Frequent hot showers can dry out the skin, increasing the risk of irritation and should be avoided. Clinical tip: advise clients with SLE to apply broad-spectrum sunscreen with SPF 30 or higher every day, even on cloudy days, to protect against UV light exposure. A 5-year-old child is brought to the pediatric clinic by their parent, who reports that the child has been recovering from viral meningitis. The parent is concerned about the child's return to preschool and future well-being. Which anticipatory guidance should the nurse provide to ensure growth and development are supported? Here are the options. Option 1. Recommend regular follow-up appointments to monitor developmental milestones. Option 2. Advise immediate return to full-time preschool activities to promote social interaction. Option 3. Encourage age-appropriate play activities to stimulate cognitive development. Option 4. Suggest limiting screen time to enhance physical activity and social skills. Option 5. Instruct the parent to restrict outdoor activities to prevent future infections. Rationale. Correct answers A, C, D. A. Regular follow-up appointments are essential to monitor the child's recovery and developmental progress after viral meningitis. C. Age-appropriate play activities support cognitive and motor development, which is crucial during the recovery phase. D. Limiting screen time encourages physical activity and social interaction, supporting overall development. Distractor rationales. B. Immediate full-time return to preschool may be overwhelming. A gradual reintroduction caters better to the child's stamina and comfort. E. Restricting outdoor activities is unnecessary and may hinder normal social and physical development. Clinical tip. After an illness like viral meningitis, gradual reintroduction to activities and close monitoring of developmental milestones are key to supporting a child's recovery and growth. A 10-year-old child is visiting the pediatric clinic for a routine checkup. The nurse is educating the child's parent about balancing the child's lifestyle amid the COVID-19 pandemic, focusing on both physical health and developmental needs. Which strategies should the nurse recommend to promote healthy growth and development during this period? Here are the options. Option 1. Ensure the child has regular outdoor playtime while maintaining social distancing. Option 2. Allow unlimited screen time to keep the child entertained indoors. Option 3. Encourage structured online educational activities and hobbies. Option 4. Promote a balanced diet with appropriate portion sizes. Option 5. Discourage the child from social interactions with peers to prevent virus exposure. Rationale. Correct answers. A, C, D. A. Regular outdoor playtime is crucial for physical activity and helps maintain mental well-being, provided social distancing is observed. C. Structured online activities keep the child engaged and can enhance learning, helping to maintain educational progress during pandemic restrictions. D. A balanced diet supports optimal physical growth and cognitive development. Distractor rationales. B. Unlimited screen time can negatively impact sleep, physical health, and social development, and should be moderated. E. While physical distancing is important, virtual or safe social interactions should be encouraged to support social development. Clinical tip. For children, balance is key. Encourage physical activity, limit screen time, and ensure a healthy diet to support holistic development during challenging times like a pandemic. A 65-year-old patient with a history of heavy alcohol use is admitted to the hospital after vomiting blood. The diagnosis is a Mallory-Weiss tear. Which nursing intervention is most important to include in the patient's care plan to ensure physiological stability? Here are the options. Option 1. Administering a proton pump inhibitor as prescribed. Option 2. Encouraging oral intake to maintain hydration. Option 3. Monitoring hemoglobin and hematocrit levels closely. Option 4. Providing a high-fiber diet to prevent constipation. The correct answer is C. Rationale. Correct answer, C. Monitoring hemoglobin and hematocrit levels closely is crucial in this scenario, as it helps to assess the extent of bleeding and ensure that the patient is maintaining adequate blood volume. A Mallory-Weiss tear can lead to significant blood loss, and monitoring these lab values allows for timely interventions, such as transfusions if necessary. This intervention prioritizes maintaining physiological integrity by ensuring the patient remains hemodynamically stable. Distractor rationales. A. While administering a proton pump inhibitor can help reduce gastric acidity, it is not immediately essential for assessing the patient's current blood loss and hemodynamic status. B. Encouraging oral intake may not be appropriate if the patient is at risk of further bleeding or unable to tolerate fluids. D. A high-fiber diet is not immediately relevant to a Mallory-Weiss tear and doesn't address the critical concern of monitoring for blood loss. Clinical tip. In cases of gastrointestinal bleeding, closely monitor vital signs and lab values to promptly detect and manage any complications related to blood loss. A 49-year-old woman, recently diagnosed with stage 3 cervical cancer, is in the oncology clinic expressing distress over the impact of her diagnosis on her life. She feels overwhelmed and unable to make decisions about her treatment. What is the most effective nursing intervention to assist her in this crisis? Here are the options. Option 1. Facilitate a family meeting to discuss her treatment options. Option 2. Provide information about cancer support groups in her area. Option 3. Suggest she delay making decisions until she feels less overwhelmed. Option 4. Connect her with a counselor specializing in oncology for crisis intervention. The correct answer is D. Rationale. Correct answer is D. Connecting the patient with a counselor specializing in oncology provides professional support tailored to individuals facing cancer. This intervention helps her process emotions, explore her treatment options, and develop coping strategies. Professional counseling can assist in reducing feelings of being overwhelmed, enabling her to make informed decisions regarding her healthcare. Distractor rationales. A. Delaying decisions can increase anxiety and does not address her immediate emotional needs. B. While support groups are helpful, she requires immediate professional intervention to navigate her crisis. C. A family meeting may be beneficial later, but her immediate emotional needs are best met with professional counseling. Clinical tip. Recognize when a patient is in a psychological crisis and promptly involve mental health professionals to optimize coping and decision-making. During a hectic night shift in the emergency department, the nurse encounters a 65-year-old male presenting with severe chest pain radiating to his left arm and jaw. His blood pressure is 90/60 millimeters of mercury, heart rate 110 BPM, and he is diaphoretic. What is the nurse's priority intervention? Here are the options. Option 1. Administer aspirin 325 milligrams orally. Option 2. Apply oxygen via nasal cannula. Option 3. Initiate an IV line and give nitroglycerin. Option 4. Prepare for immediate defibrillation. The correct answer is C. Correct answer explanation. Initiating an ID line and administering nitroglycerin is priority to relieve the chest pain and improve coronary circulation. This action addresses the root cause of potential myocardial infarction symptoms. Incorrect answer explanations. Option A. Aspirin is important but not the immediate priority over nitroglycerin. Option B. Oxygen is necessary but should follow the initiation of medication. Option D. Defibrillation is not indicated in the absence of arrhythmia. In the post-operative recovery bay, an alert client suddenly develops difficulty breathing and their oxygen saturation drops to 88% on room air. The client is post-thyroidectomy. What should the nurse do first? Here are the options. Option 1. Increase oxygen delivery via face mask. Option 2. Monitor vital signs closely. Option 3. Assess for signs of hypocalcemia. Option 4. Prepare for possible intubation. The correct answer is C. Correct answer explanation. Assessing for signs of hypocalcemia is crucial because the parathyroid glands may have been affected during surgery, leading to low calcium levels, which can cause muscle spasms affecting breathing. Incorrect answer explanations. Option A. Increasing oxygen doesn't address the underlying cause. Option B. Monitoring is necessary but not the first action. Option D. Intubation is premature without assessing the cause. A 25-year-old client with a diagnosis of histrionic personality disorder is attending a community health workshop on personal development and lifestyle choices. Which strategy is most effective for promoting this client's growth and self-care in the context of their condition? Here are the options. Option 1. Encourage participation in group activities to foster social interactions. Option 2. Focus on developing a routine that minimizes social engagements. Option 3. Advise the client to avoid emotionally expressive situations. Option 4. Recommend the client to keep a journal of personal achievements and goals. The correct answer is D. Rationale. Correct answer D. Keeping a journal of personal achievements and goals helps individuals with histrionic personality disorder to focus on self-awareness and personal growth rather than external validation. This strategy promotes introspection and self-care, encouraging clients to set realistic goals and reflect on personal development. By documenting achievements, clients can gain a sense of accomplishment from within, which aids in reducing dependency on external approval. This aligns with health promotion by fostering a sense of self-worth and internal satisfaction. Distractor rationales. A. While social interaction can be beneficial, individuals with histrionic personality disorder may seek excessive attention in group settings, which does not promote personal growth effectively. B. Minimizing social engagements can lead to isolation and does not address the need for developing healthy interpersonal skills. C. Avoiding emotionally expressive situations does not contribute to personal growth or self-care, as it may prevent the client from learning to manage emotions appropriately. Clinical tip. Encourage clients with personality disorders to engage in self-reflective practices like journaling, which can enhance self-awareness and personal growth. An 8-week-old infant with necrotizing enterocolitis is being cared for in the Neonatal Intensive Care Unit, NICU. The nurse notices that the infant's abdominal girth has increased significantly over the past hour, and the infant appears lethargic. What is the most appropriate initial action for the nurse to ensure a safe care environment? Here are the options. Option 1. A. Administer prescribed antibiotics immediately. Option 2. B. Notify the physician and prepare for possible surgical intervention. Option 3. C. Reassess the infant's vital signs and check for signs of shock. Option 4. D. Increase the frequency of abdominal girth measurements. The correct answer is C. Rationale. Correct answer, C. Reassessing the infant's vital signs and checking for signs of shock is the most immediate and appropriate action. It provides critical information on the infant's current status and helps determine if emergency interventions are needed. Increases in abdominal girth and lethargy could indicate perforation or worsening of the condition, which are life-threatening. Accurate vital sign assessment is crucial in guiding subsequent interventions and ensuring the infant's safety. Distractor rationales. A. Administering antibiotics is important, but should not take precedence over immediate assessment when deterioration is suspected. B. Notifying the physician is necessary, but should occur after a thorough reassessment of the infant's current condition. D. Increasing the frequency of measurements does not address the immediate potential for deterioration and could delay critical interventions. Clinical tip. In NICU settings, rapid assessment of vital signs is key to identifying potential emergencies, especially in conditions like necrotizing enterocolitis, where changes can be rapid and life-threatening. A 23-year-old female patient with a known history of human papillomavirus, HPV, presents to the emergency department with severe vaginal bleeding and reports recent sexual assault. As the initial responder, what is the nurse's immediate priority? Here are the options. Option 1. Conduct a forensic examination for evidence collection. Option 2. Stabilize the patient's hemodynamic status. Option 3. Obtain a detailed sexual history. Option 4. Consult a gynecologist for specialized care. The correct answer is B. Rationale. Correct answer B. The immediate priority in this emergency scenario is to stabilize the patient's hemodynamic status due to severe vaginal bleeding. This involves assessing and managing the patient's airway, breathing, and circulation, ABCs, ensuring adequate perfusion and preventing shock. While evidence collection and history are important, they are secondary to addressing life-threatening conditions. The nurse's role in an emergency is to prioritize interventions that stabilize the patient's condition first. Distractor rationales. A. While forensic examination is crucial, it should be performed after the patient is stable. C. A detailed history may be necessary later, but is not the immediate priority in an emergency. D. Consultation with a specialist is important, but comes after addressing acute medical needs. Clinical tip. In emergencies, always prioritize interventions that address the patient's immediate physical stability before proceeding to secondary concerns. A 25-year-old female client is diagnosed with histrionic personality disorder. During a health promotion session, what developmental task should the nurse focus on to aid the client in achieving appropriate growth and development? Here are the options. Option 1. Developing intimate reciprocal relationships. Option 2. Establishing independence from parents and family. Option 3. Exploring career options and committing to a career path. Option 4. Achieving a sense of self-worth through achievement. The correct answer is A. Rationale. Correct answer. Developing intimate reciprocal relationships is a key developmental task for young adults, particularly for those with histrionic personality disorder. Histrionic individuals often struggle with maintaining genuine, close relationships due to a focus on gaining attention. Health promotion should focus on helping these clients foster true intimacy and emotional connections, which are essential for healthy adult relationships. Distractor rationales. B. While achieving self-worth through achievement is important, it is more relevant to later adulthood. C. Exploring career options is more aligned with adolescent development. D. Establishing independence is a task typically associated with late adolescence. Clinical tip. In clients with personality disorders, promoting age-appropriate relational skills can enhance mental health and social functioning. An elderly client with a history of cirrhosis presents with portal hypertension. The nurse is planning basic care for this client in the hospital. Which of the following nursing interventions should be prioritized to reduce the risk of complications associated with portal hypertension? Here are the options. Option 1. Monitor stool for blood. Option 2. Encourage a low-protein diet. Option 3. Position the client in a high Fowler's position. Option 4. Assess for signs of hepatic encephalopathy. Option 5. Administer prescribed beta blockers. Rationale. Correct answers. A, C, D, E. Monitoring stool for blood is crucial as gastrointestinal bleeding is a common complication of portal hypertension. C. Positioning the client in a high Fowler's position can help reduce the risk of respiratory complications by enhancing lung expansion. D. Assessing for signs of hepatic encephalopathy is important as it can occur due to toxins not being adequately cleared by the liver. E. Administering prescribed beta blockers helps decrease portal pressure and reduces the risk of variceal bleeding. Distractor rationales. B. A low-protein diet is generally not recommended for clients with portal hypertension as it can lead to malnutrition and muscle wasting. Clinical tip. In clients with portal hypertension, regularly assess for signs of bleeding, including melena and hematemesis, as these are potential life-threatening complications. A 50-year-old client presents to the clinic for a routine checkup. The client has no significant family history of illness, but reports occasional constipation and a recent change in bowel habits. As the nurse, what is the most appropriate action in line with colorectal cancer screening guidelines? Here are the options. Option 1. Recommend a colonoscopy every 10 years starting at age 50. Option 2. Advise an annual fecal occult blood test, FOBT. Option 3. Suggest a sigmoidoscopy every 5 years. Option 4. Encourage increased fiber intake to manage constipation. The correct answer is A. Rationale. Correct answer, A. Current guidelines recommend that average-risk adults begin regular screening for colorectal cancer at age 50, with a colonoscopy every 10 years. Colonoscopy is considered the gold standard for colorectal cancer screening because it allows for direct visualization and removal of polyps. This recommendation is based on evidence that colonoscopy can significantly reduce mortality from colorectal cancer. Distractor rationales. B. While annual FOBT is a screening option, it is less comprehensive compared to colonoscopy and is typically recommended in conjunction with other methods. C. Sigmoidoscopy every 5 years is an alternative option, but it does not visualize the entire colon, unlike colonoscopy. D. Increasing fiber intake is beneficial for managing constipation, but does not address cancer screening specifically. Clinical tip. Encourage patients to follow colorectal cancer screening recommendations, as early detection greatly improves treatment outcomes. A 15-year-old adolescent has been newly diagnosed with Hodgkin's lymphoma. The nurse is providing health promotion education to the family. Which of the following topics should the nurse prioritize to support the adolescent's growth and development during cancer treatment? Here are the options. Option 1. Encouraging participation in age-appropriate social activities. Option 2. Discussing chemotherapy side effects that may impact learning. Option 3. Focusing solely on physical recovery and treatment adherence. Option 4. Promoting healthy communication between the adolescent and peers. Option 5. Restricting physical activities to prevent injury at all times. Option 6. Ensuring a balanced diet to support the body during treatment. Rationale. Correct answers A, B, D, and F. A. Encouraging social activities helps maintain normalcy and supports psychosocial development. B. Understanding how treatment impacts learning can help manage expectations and promote school involvement. D. Healthy communication with peers is crucial for emotional support and maintaining social networks during challenging times. F. A balanced diet is important to support growth and the body's healing process during treatment. Distractor rationales. C. Focusing solely on treatment adherence neglects the adolescent's psychosocial needs, which are crucial during development. E. Restricting all physical activities can hinder development and reduce the adolescent's quality of life. Activities should be adapted, not eliminated. Clinical tip. When dealing with adolescent patients, always consider their psychosocial needs alongside physical health to promote holistic growth and development.
Okay, that was it for today's adaptive quiz bank session. So now you can click Finish and go through all the rationales for both questions you got wrong and right for more in-depth understanding of the concepts. This page will show all the details about what you just studied, and at the end it will update on your personalized study plan, and the progress section on your dashboard will be updated based on this. To access question banks like this, don't forget to check out our website, yournursingspace.com, for further details. And don't forget to check out our Ultimate NCLEX Mastery Notes at yournursingspace.com. While you're there, explore all our other free guides and study notes available to support your NCLEX journey. You can also check out our test bank platform, Exam ASAP, our advanced adaptive testing platform featuring over 5,000 peer-reviewed questions designed to mirror the NCLEX experience. It includes detailed rationales, daily content updates, and a 24/7 AI tutor, resources recognized as industry-leading and proven to enhance your performance. Not only that, our question bank platform has next-generation NCLEX question types with case studies. We are adaptive and AI-powered platform that allows you to pass the NCLEX the first try. With our question bank platform, you are able to see the analysis of how ready you are for the NCLEX exam with a detailed analysis based on your performance. So check out our website for all those goodies. And I hope this lecture helped you feel a bit more confident whether you're studying for nursing school or gearing up for the NCLEX. Again, I'm Mark Johnson, your NCLEX instructor here at YNS, and I'll see you in the next lecture.